Good morning, ladies and gentlemen. My name is Ronald Young. I am the Director of Patient Education and Engagement here at the James H. Quillen VA Medical Center. We are located at Mountain Home, Tennessee, which is a relatively small community in East Tennessee. Our geographical service area for the facility covers parts of Kentucky, all of East Tennessee, parts of Virginia, and we even have some patients that come as far as from Georgia. This is the main facility, and we have 9 satellite clinics located around the geographical service area. But we also are in close proximity to the Appalachian Mountains and a lot of very rural areas. So we have a large geographical service area, highly dense population of veterans within that service area, and a lot of very rural and unfortunately financially disabled individuals that need and deserve the care that the VA provides. Having said that, the selection of telehealth and telemedicine as my topic for this presentation seemed natural. This is something that at my facility we have talked about on a number of occasions and have tried some minor implementations. One of the most successful we've done is telewound, but we're looking into expanding our processes and our availabilities, and certainly have a very high need and a mandate to provide this sort of care. So again, that's why I chose the topic, which is telehealth, telemedicine. Went into some of the development, utilization, and the applications as I see them for the future of the VA and healthcare and medicine in general going forward. First thing I always like to do when I'm making any kind of presentation is define my topics, especially if they're ones which not everyone may be really well aware of. So I've defined telehealth here as a wide variety of methodologies and methods for enhancing population health care, and the delivery of health education, utilizing technology and telecommunications to support the availability of long-distance health care, health consultations, health and wellness education. For a variety of reasons, paramount among these is to ensure access to high-quality health-related services to isolated, rural, and disadvantaged populations. I took this definition directly from healthit.gov. I usually use .gov sources for most of my facts, documents, and references. As being a federal employee and a VA employee, I find those to be well received within my scope of practice here. There are certainly probably almost as many different definitions of telehealth and telemedicine as there are websites that describe it, but they all have a basic general descriptive that it is the utilization of technology to provide health-related services. So that's how we will define it here for the purposes of this presentation. I'm going to first start out with, after the definition of the basic concept, some of the basics of telehealth as it's laid out in the research that I did. Telemedicine is often still used to refer to the traditional clinical diagnosis and monitoring delivered by technology, but in the last several years, the term telehealth is becoming more commonly used as it describes a much wider range of diagnoses, management, education, a lot of other related fields of healthcare. Some of these that I found in my research included counseling for mental health issues, physical and occupational therapy via telehealth, home health, chronic disease monitoring and management. Many of us are familiar with some aspects of that. Disaster management was one I wasn't really familiar with. Consumer and professional education. We're all well aware of telecommunications and teleeducation, much like the program we're all just completing. Another one that I found interesting I had never thought about was dentistry, the visualization through electronics maybe to a dental specialist from a remote area out in the field or out in someone's home. So there's a lot of applications for telehealth other than just clinical diagnosis and monitoring. So the term telehealth has kind of superseded telemedicine as far as the buzzword that's used. How do you define telehealth as far as policy? Well, unfortunately, at this point in time, state and federal agencies often differ widely on how they define telehealth and what qualifies as telehealth. California has a totally different description of telehealth as some other states. So, and the federal government obviously has its own definition. So these varying definitions certainly influence policies and regulations surrounding how telehealth is allowed to be used. And they vary as much, as I said, across states as the definitions themselves. So it will be, going forward, really important that we look at the opportunity to come up with a concise, accepted across-the-board definition of telehealth, because that will play into reimbursement issues and consistency across the board. But I did want to bring up, telehealth is not a new concept. The initial efforts began in the 50s and 60s. In fact, in 1948, the first radiological images, X-rays, were transmitted across a telephone. And in Montreal, a system was developed in the 1950s for radiological image transmission. The University of Nebraska was one of the first places that actually used it. It was the first institution to use video communication for medical purposes. And they transferred back in 1960 two-way interactive information across the scope of their campus. So those are some very early. So what is telehealth functionally? Well, then around the 1950s, telemedicine kind of really started to mold itself into an early version of what is seen today. We mentioned Montreal and University and some of the radiological transmissions. By the end of that decade, they were using quite a bit of two-way interactive television to send information across campuses, and many of these early cases were built due to concern over reaching rural patients. But by the 60s, urban centers were rapidly adopting the technology and adjusting it to fit into their own needs. For example, in Miami, the First Department and University Medical Center worked together to transmit electrocardiographic rhythms over voice radio channels for fire rescues, something that is still common practice today, to send information, including cardiac rhythms, in emergencies to the hospital, to emergency room doctor or cardiologist, so those things can be evaluated in the field. So what is telehealth functionally? Well, it consists of a multitude of things. It can be live video feeds that are going on at the same time. The doctor is talking to his patient. You can see the provider and patient. Between the provider and especially the clinician, you have for instance, a general practitioner who has some questions about a clinical situation. He or she has the ability now, through the use of telehealth, telemedicine, to contact that specialty clinician who might be in another city or on the other side of the world, and discuss the case, discuss the situation, get advice, things of that nature. It can be between patients and other patients. Many self-help groups, many support groups, things of that nature have been set up around the country where patients, for instance, cancer survivors, can interact with other cancer survivors. Obviously, there are a lot of local groups like this as well, but there are the elements of telehealth and telecommunication involved in some of these groups as well. And then between providers and centralized facilities, much as I said about our facility here being located in Mountain Home, and we have clinics that are over 100 miles away from us geographically. So telehealth and telemedicine would allow, say, a clinician located 100 miles away to actually interact with providers or professionals here to get, again, advice and suggestions. Another utilization of telehealth and telemedicine functionality is referred to as store and forward. So it's asynchronous. It doesn't happen at the same time. But for example, a provider or a clinician in the field could take photographs, videos, X-rays, documentation. This is something that plays exactly into what we're trying to do with wound care here at this facility, where a field clinician can take photographs and things of that nature of say a pressure wound, and they can store them and forward them to our wound care specialists here at the facility for evaluation, treatment regimens, things of that nature. Obviously, all these things need to occur over a secure connection. We have HIPAA and a lot of other privacy laws and things that require that attention be paid. And is typically for subsequent review by a specialist in an indicated field for consultation. As I mentioned, wound care being an excellent example, whereas we have several on-site certified wound care specialists, but they don't go to the field. So in the very early stages of, say, a pressure ulcer, a field clinician could take pictures, take video, whatever, if it was necessary, documentation, store it, send it to our specialists here at the center, and if they felt that person then needed to seek medical attention, they could advise that. If they had specific dressing, specific clinical things that they thought that person should do, all those things could be prescribed through the telemedicine type connection. And I wanted to talk about as far as functionality was regarding remote monitoring of patients' conditions. Most people who work in the medical field, and a lot of people who don't, are aware of, say, the monitoring of a Holter monitor, cardiac rhythms and things, where the data is transmitted to healthcare providers in real time for later review. The same thing on a much smaller scale happens in, say, a telemetry ward. For example, here we have mobile telemetry sets that we put on our patients, and they're free to walk around, go down to the cafeteria, walk around the grounds, whatever, but they're being monitored in real time. So that's a small concept of telehealth, but this can be done at much greater distances. So you could be at your home instead of in a hospital and being monitored for a cardiac dysrhythmia or something along those lines, where it would be looked at real time, and then if some scenario developed, then you would be directed, or they could call 911 for you, or whatever was medically necessitated. So it allows providers to track healthcare data between face-to-face encounters. You don't have to come in as much. Has been proven to reduce readmission rates and allows the patients to remain in their home and community while still receiving health supervision. So the patient's not alone. They are aware that they're being monitored. They are aware that there's somebody is staying up to date on their current situation, but they're still able to be at home, as opposed to, again, being in a hospital, being in a community living center, or some of those type things. And most people, given the choice, prefer to. The somewhat newer, more recent advent of telehealth and functionality is mobile health initiatives. Almost everyone today has a cell phone. The PDAs have been around for a while. Tablets, obviously wearable devices are becoming more and more common. So all these are mobile electronic devices that the client or the patient can have, and they can serve a lot of purposes. Main ones that I notice in my research, I mean, there's some small amount of monitoring, perhaps that will grow even more so, but lifestyle messages. There's a ton of sites, not just medical, but all kinds of different things that you can sign up for, messages and things. I know at the VA we do have a program to where we send out blurbs and text messages and things. Get your flu shot. Be aware of different things. On the slide here it says notification for health-related alerts, Zika, Ebola, flu. All these kind of things you can get notifications of if you're signed up for them. And the geographical health reminders, like I just said, we're moving into the flu season now, so those things will start going out to all our patients, just as reminders. People forget, people get busy, and again, almost everyone has their cell phone with them at all times. So getting that while you're walking through the store, and you get that reminder of health initiative reminder to get your flu shot, it might prompt somebody to stop at that point and walk over to the Walgreens and get a flu shot. So it's all about preserving health and doing anything you can to get the information out, educate people, make them aware, notify them, and give them little prompts, those kind of things. So more than anything, the mobile health initiative has become a user-directed health technology, as opposed to the other topics that we mentioned. So a lot of people. What are some of the advantages of telehealth? Well, it's convenient to patients and providers. According to a recent Cisco Global survey, 74% of patients prefer easy access to healthcare services over in-person interaction with providers. So people want convenience. Americans want convenience in everything they do, and that's no different in their healthcare. No one likes to wait. No one likes to spend an entire morning to have a 15-minute session with a physician or a nurse practitioner. So the convenience aspect. Cost savings. There's a huge amount of cost savings associated with telewound, telehealth, all these services that can be made available, not only in the cost of the provider's time, but in the cost of the patient's time and in the cost of patient travel, which is not something that's a lot of times included in the healthcare cost matrix. The cost of patients as far as their time and their effort and their money is usually not captured in those. So it's a invisible cost maybe from the healthcare side, but to the patient this can be really important. If you have 100 miles to drive for an appointment and gas is at $2 a gallon, I mean that could be a considerable amount of money for that person. Access to specialists for referral. Specialists a lot of times are congregated around urban centers, larger cities and things. I mean, they go where there's a large patient population and where the need is and where they can obviously generate the most return on their investment in school and education. So it allows access to specialists over telehealth that you might not have access to otherwise, or might have to travel a great distance to get to. Telehealth may improve patient engagement and healthcare issues, activities, concerns. We talked about the mHealth, the mobile health, just a minute ago. Having that ability to make that kind of contact on a routine basis, having those kind of prompts and things certainly won't for everyone, but it may engage and encourage certain individuals to be more conscious of healthcare issues, activities and concerns. They can get notification about weight loss, exercise, diabetes control, any number of things. And lastly, the quality of patient care may be improved because the remote analysis and monitoring, electronic data storage, significantly reduce cost, and most costs in healthcare are rolled on into improving services, so the quality of the patient care may be improved. So where are the settings for telehealth application? Well, obviously we've spoken to rural and isolated areas, and that's makes sense to most people, I think. Schools, one that didn't come first to mind for me, but it makes a lot of sense after doing the research. Most schools have a medical person, maybe it's referred to as the school nurse, but there's going to be minimal ability, and obviously it's a scenario where if there's something out of the scope, you can send them on to a facility via ambulance or whatever. But for instance, say a child reports with a rash or something of unknown origin, the school could potentially send a video in real time, consult with a specialist, consult with a facility, a doctor, and make some determination on whether that child needed to come into the facility, needed to go home, needed basically some cortisone cream put on it, whatever the situation might be. Military application, all of us, or I shouldn't say all because I'm not positive, I think most of us in the program are military associated, so military applications for telehealth are relatively obvious. Combat injuries and things of that nature can be assessed by physicians. Combat injuries in theater, or illnesses for that matter, different things can be assessed by, say, somebody in the continental United States, specialists and things of that nature. So you can see that application. Assisted living facilities and nursing homes. A lot of cost is involved in transporting generally a nursing home patient to a hospital facility for treatment or evaluation. If that cost can be minimized through telehealth, then that person can stay where they're comfortable. Ambulance services and emergency room services and all those things don't have to come into play, There can be a great deal of cost savings and comfort for the patient involved in that. Home health, another one. Home health practitioner goes out to their patient in the field and they see something they're not very familiar with or they're concerned about. They can consult with someone back at the facility or a specialist and get a determination. Again, could save a lot of finances in regards to travel, emergency room visits, ambulance visits, and things of that nature. Prisons, another great application. There's a great deal of expense involved in transferring a prisoner, a great deal of expense and security issues in transferring a prisoner from a prison to a healthcare facility. A lot of extra guards, the transportation, all the potential risks that are involved in that. Telehealth allows prisons to use that technology to evaluate and get treatment regimens and things of that nature for prisoners. So again, it cuts down on a great deal of expense and the other things associated with transferring the prison population to a civilian clinic. Clinics, inner city locations, again, lack of specialists, usually minimal staff there, so the ability to consult with specialists or consult with other practitioners around the area that might be more than happy to donate some time for that, but they simply physically can't or are not able to come to the clinic and donate physical time, can allow them to be available to the practitioners that are in the clinics to evaluate situations and clinical issues and prescribe treatments and regimens of recovery. Outreach, mission trips. Obviously, a lot of Americans go on mission trips overseas and things. So again, telehealth might be would be a very valuable option for medical and healthcare people going on mission trips to get consults. And some of the benefits: access is improved across the continuum of care. We've talked about specialists, we've talked about hospital access, we've talked about all those kind of things. So access is improved. People would have more opportunity if telehealth reaches the level that hopefully it will and should get to. Many more people who currently may not have access to care, or certainly may not have access to the best levels of care, would have access. Efficiencies are improved relative to cost through a number of factors. Like we've talked about the transportation issues, we've talked about the emergency room visits, we've talked about the over-treatment, the over-admissions, and things of that nature. So, and anyone who's ever worked in a hospital know a lot of people come into the hospital that didn't really need to be admitted, but they are. It's just a fact of coming to the facility until somebody can say no, they don't need to be here, and they get discharged. But the cost has already been encountered. Quality is improved in many cases over traditional face-to-face encounters. Generally, a telehealth type communication is going to be more relaxed for both the patient and the provider. The patient can wait for that encounter to occur in their own home or in a clinic near their home. The provider can do it from their own office in their own space where they're comfortable, where they have their resources available readily to them. So a lot of times the quality is actually improved and the communication is better. A large portion of consumers want telehealth services. People, again, back to the other slide, want convenience. They don't want to have to travel. They don't want to have to wait. They want their situations dealt with in a timely manner, and they want to get on with their lives. And that's one thing that telehealth most assuredly gives people the option of doing. So what services are available right now? Well, education and wellness information designed for healthcare consumers. We talked about the mobile health, and I'm sure everyone is familiar with at least one and probably dozens of apps that can be downloaded for the phone and things to monitor all manner of things: diet, exercise, weight, just virtually anything that you wanted to. Remote monitoring of patient's progress or condition. We talked about the cardiac monitoring remotely, congestive heart failure, things of that nature, which years ago would require you to be in a hospital and be monitored and be hooked up to the machines. Now you could go about your activities of your daily life and still be receiving medical monitoring. Referral services, both with clients and with other medical professionals. We talked about the referral aspects to specialists. Medical education opportunities for providers in remote locations. One thing that is often overlooked again. Providers in remote locations also don't always have easy access to continuing medical education. And a lot of times the funding is very low to send them to areas that do have continuing medical education. So telehealth, telemedicine is another opportunity for, say, a specialist in Atlanta to reach out to one of our rural clinics or several of our rural clinics and provide an educational session on any number of things. The latest research, perhaps, on diabetes or congestive heart failure. So a lot of great opportunities for education relative to that. How is it delivered? Well, most web-based sites for providing information and education designed for both consumer and health professionals. We all know that there is a ton of consumer-based healthcare sites. Within the VA system, we have My Healthy Vet, which is a VA-designed web-based portal exactly for this. It answers medical questions on almost anything that a veteran might have. And it's again, it's My Healthy Vet. If you have any interest, you can just go to Google and type in My Healthy Vet, and it doesn't matter if you're a vet or you receive any kind of care from the VA, you still have access to it. So it's a pretty extensive site. Point-to-point connections allow for direct contact and collaboration between patients and providers, or providers and specialty providers or services. So point-to-point would be, for instance, the hospital in Atlanta had point-to-point connections with a hospital in Bethesda, Maryland, and they sometimes they would be set up already, but there would be those at-need consults with patients, providers, and specialty providers or services. Next works connecting primary facilities with clinics and other outlying provider locations. This is something that we're looking for here, where we have all these little clinics out in the community that provide excellent service, but they're limited. Limited on staff, limited on specialty knowledge, and limited on the services they can provide. So having them networked here to the main facility would provide them access. A lot of logistics have to be worked out. Time has to be set aside. Nothing is without some teething problems, but it would be ultimately much more financially responsible and much more convenient for the patients as well as the providers when and if we get to that point. So what are drawbacks? Everything sounds like everything's positive. There's absolutely nothing wrong with it. And there's really not, but there are some drawbacks. Initial cost. Equipment is expensive, and training is expensive. So both of these things have to be considered when you're thinking about entering into a telehealth, telemedicine, or expanding an existing telehealth, telemedicine program. Technology changes constantly, so there's an ongoing training and equipment burden that's associated with telehealth, telemedicine. Decreases the number of face-to-face consultations. Again, there's two ways to look at that. We've already established that the majority of patients prefer convenience over face-to-face consultations. So there is always the possibility that some people will slip through the cracks. Some people don't like the lack of face-to-face consultation. They actually want to see the physician or the provider face-to-face. That option will certainly still be available. But for the vast majority of people, I think that based on the research, they would prefer telehealth to face-to-face consultations for the reasons I've already mentioned. Reimbursement issues. I mentioned the differences, the way states and the federal government look at telehealth, what qualifies as telehealth, and those sort of things. So insurance hasn't caught up with us. And those are some issues that remain to be seen. How will we be reimbursed? At what percentage will we be reimbursed for a face-to-face consult as compared to a telehealth consult? And things of that nature. But reimbursement issues are a concern. Continuity of care. If you have, say, for instance, a call-in center, and you call in and you get talk to a physician, and the next time you call in you might talk to a different physician, whereas if you use your local clinic or your local physician or your family physician in your community, there is that continuity. So that is an issue, certainly, to maintain that continuity, particularly for patients with long-term illnesses and things of that nature. Patient safety and security. Excuse me. The internet's wide open. There's hacking that occurs in the most protected of sites every day. So this is a real concern for a lot of people. Maintaining their privacy, maintaining their information related to health is very important. So that's something that you have to work out with your IT people and get as much as you can get. I mean, nothing's foolproof. It's been shown multiple times, but as much security associated with that as you possibly can. In the day of cyber crime and identity theft, it becomes a real issue for a lot of people. So that has to be considered a drawback to utilizing telehealth, telemedicine. So, in conclusion, there's unprecedented opportunities for expanding care and consultation. The rapid expansion driven by internet accessibility and technology awareness has made the possibility and probability of using telehealth much greater than it would have been, say, 15 years ago. So the possibility is out there. It's not everywhere, but it's expanding, and it's expanding every day. So the possibility is definitely there. Tons of applications to include in-home use. It's very convenient for both parties, all parties involved. It's cost effective. It allows for greater reach of limited providers. We spoke of the specialty providers. So a specialty provider sitting in their office conducting say a session on congestive heart failure could potentially reach hundreds of people through a teleconference as opposed to seeing one person at a time in their office. So the expanse is tremendous. Improved health outcomes, we spoke to that, and it's a valuable adjunct to health-related education. We talked about the medical education. That also applies to all the other ancillaries, nursing, physical therapy, all disciplines within the healthcare realm. And it is healthcare into the next century. As things become more and more expensive, the population continues to grow, economic issues continue to be at the forefront, which there's no reason to anticipate that they won't be. Providing quality health care to as many people as we possibly can has to be our main focus. And the use of telehealth, telemedicine, and all other technology that is available to us has to be something that everyone focuses on going forward. I wrapped up my presentation with a list of references here. They're not referenced in the body of the material other than the IT definition for telehealth, but I did read all these documents and I found them to be very interesting, very informative, so I did want to list them here in case anyone had any further questions or anything that they would like to delve into a little bit more. I thank you very much for giving me the opportunity to share what I found out and what I learned about telehealth and telemedicine with you. Wish all of you the very best in your future endeavors, and perhaps I'll see you again in some other educational effort. Thank you very much. Goodbye.